According to data from WHO and GlobeCan project, 19.3 million new cancer cases were diagnosed worldwide in 2020, and more than 4.5 million of newly diagnosed tumor patients have distant metastases. Treatment selection for metastasis cancer depends on the type of cancer. Thereby, accurate and rapid identifying the primary tumor is critical for improving the prognosis of metastatic tumor patients. Canhelp Origin test was developed and manufactured by Canhelp Genomics. It is the first and only NMPA-approved test for tumor origin diagnosis, and it is also CE certificated. The test system consists of an IVD kit and software. Canhelp Origin test is a real-time PCR-based in vitro test that analyzes a tumor's gene expression pattern to assist in identifying the tissue of origin, which is valuable in classifying metastatic, poorly differentiated, or undifferentiated cancers. Canhelp Origin test assesses 90 tumor-specific genes. It identifies 21 common tumor types and over 50 subtypes. And based on WHO's statistical data on new cancer cases occurred in 2020, the test covers 95% of cancer patients by incidence. In a blinded, multi-institutional validation study, the test showed an overall accuracy of more than 90%. For pathologists, Canhelp Origin test can be very helpful when the tumor is poorly differentiated or undifferentiated, or when the specimen is small, which constrains the diagnostic workup, when IHC results are inconclusive or contradict with the first-round results, or when unable to differentially diagnose 2 or more cancer types. For oncologists, Canhelp Origin test can assist to diagnose and treat patients when patient has a history of multiple cancers, or when metastatic sites are atypical, when clinical and pathological diagnoses are inconsistent, or there is doubt about initial diagnosis when the patient fails initial therapy. Canhelp Origin test requires serial sections of tumor tissue with thickness of 5 micrometers. Surgical specimens require 10 to 15 slides, while puncture specimens require 20 slides to achieve reliable results. The total number of tumor cells should be more than 500. A pathological report of the patient is required for reference. One H&E stained slide is needed for quality control. The slides can be transported at an ambient temperature. The compatible instrument is Thermo Fisher's ABI 7500 real-time PCR system. Canhelp Origin test process includes sample processing, RNA extraction, cDNA synthesis, RT-PCR detection, and data analysis and report. The test can be completed within 6 hours. For each case, Canhelp Origin test analyzes the gene expression pattern of the 90 tumor-specific genes and generates similarity scores for each primary tumor type based on the degree of similarities of the test specimen to the gene expression database. The range of similarity score is from 0 to 100 for each tumor type. The tumor type with the highest similarity score is the type of tumor origin. The results of researchers using Canhelp Origin test has been published in more than 13 scientific articles and presented at over 7 global conferences. The test has been used in 20 research institutions worldwide and has been validated on more than 3,000 patients. Canhelp Origin test can be widely used in cancer of unknown primary, brain metastasis, liver metastasis, triple-negative breast cancer, and multiple primary tumor. Cancer of unknown primary (CUP) is a class of metastatic malignancy detected when the site of primary origin cannot be determined precisely after complete assessment. Includes patient history, physical examination, imaging, serum markers, and pathologic evaluation of tumor samples. CUP constitutes 3% to 5% of all newly diagnosed cancers per year worldwide. In total, 600,000 to 1 million patients CUP usually has poor prognosis of overall survival of 2.7 to 11 months after diagnosis and a 1-year survival rate of 15% to 20%. In the real-world cancer of unknown primary cohort, Canhelp origin test provides meaningful diagnosis for 82.3% of CUP patients. A prospective randomized phase 3 trial is currently being performed to further investigate the clinical utility of Canhelp origin test in predicting primary site and directing therapy in CUP patients. Brain metastases are the most common intracranial tumors. Epidemiological data shows that 9 to 17% of all newly diagnosed cancers will ultimately metastasize to the brain. The frequency of brain metastasis is highest for lung cancer, followed by breast cancer and melanoma. Among brain metastases, about 2 to 14% of patients present with an unknown primary site despite intensive evaluations. In a clinical study, Canhelp origin test accurately predicted primary sites in 91.9% of brain tumor patients, thereby assisting oncologists to apply precise treatments and leading to improved care and outcome for brain metastasis patients. Liver metastases are tumors that have propagated to the liver from tumors originating from other parts of the body. Up to 50% of patients with various tumor types will occur in liver metastasis. Liver CUP is the most common CUP subgroup, with a median overall survival of 1 to 2 months and a 1-year survival rate of 5 to 12%. The Canhelp origin test achieved an overall accuracy of 93.8% in identifying the primary sites of liver tumors. It also attained 93.1% and 100 agreement rates in classifying liver metastasis and primary liver tumors, respectively. For the most common primary tumor types, Canhelp origin test showed similarly encouraging concordance rates. In characterizing liver metastasis originating from the ovary, colorectum, breast, neuroendocrine tissues, and pancreas, triple-negative breast cancer accounts for 12 to 20% of all breast cancer cases and is characterized by a lack of ER and PR expression, combined with an absence of both overexpression and amplification of the HER2 gene. Triple-negative breast cancer is associated with a high rate of relapse and poor outcomes within the first 3 years after treatment. Canhelp origin test shows a high accuracy of 97.4% in identifying primary and metastatic triple-negative breast cancer tumors, suggesting the potential of Canhelp origin test as a complementary tool to support the diagnosis of triple-negative breast cancer. Multiple primary tumors are defined as 2 or more histologically distinct malignancies in one individual. The frequency of multiple primary malignant tumors in the cancer population varies between 2.4 and 8% and is up to 17% within 20 years of follow-up. Identifying the tumor origin of the new lesion for patients with a cancer history is crucial for selecting the treatment strategy. Canhelp origin test reached an overall accuracy of 93.2% in multiple primary tumors, which could serve as a valuable tool for identifying the primary site of new lesions for cancer patients. Specifically, Canhelp origin test attained a perfect agreement rate of 100% in classifying tumors from the colorectum, ovary, endometrium, and breast. Canhelp Genomics Company was established in 2015 in Hangzhou, China. The company started to co-develop product with Fudan University Shanghai Cancer Center in that year. In 2016, the company strategically aligned with Thermo Fisher and set up its own certificated manufacture facility. The R&D of Canhelp origin test was completed in 2017. The research results were published in Modern Pathology. In 2018, a multi-center clinical trial was launched for Canhelp origin test's medical instrument registration. In 2019, the R&D of Canhelp uriblood test for bladder cancer detection was completed. The clinical data was published in the Journal of Molecular Diagnostics. In 2020, Canhelp Clinical Laboratory was set up and certificated. In 2022, Canhelp Origin test was approved by NMPA and was CE certificated. Canhelp Genomics is a leading molecular diagnostics company that develops genomic tests for personalized medicine. Our mission is to improve cancer patient care globally by resolving diagnostic uncertainty with trustworthy evidence so that personalized, precise, and effective treatments can be applied. We can help patients.